exactly is PCOS?
PCOS is like a group of symptoms that make up a condition. You understand? That's why it's a syndrome, and it involves the ovaries producing excess male hormones that now fluctuates your menstrual cycle. Every woman has androgens, but if they are now in excess, that they are subduing your female hormones, that is when PCOS starts. Your menstrual cycle will start fluctuating and you start noticing other signs and symptoms of it. So it's just a hormonal disease condition.
At what age does it start?
PCOS doesn't have a specific age, but once a woman gets into her childbearing age, which starts from, let's say, 15, 16 to 45. So within that range, PCOS can happen at any time. Once you are old enough to get pregnant, it can start. But you may not notice it until you actually start trying to make a baby.
So what are some of the common symptoms of PCOS?
When you start noticing that your cycle is irregular, I think that's the primary thing that you notice first that will make you to want to ask more questions. That maybe it flows longer than it used to, or sometimes you don't even see it at all for months. That's like the first thing you notice, and then you start checking out if you have other symptoms. So you may also start noticing that you have darkening of skin or skin tags. Skin tags are normal, but there is a way you have skin tags. You start looking into it. You can also notice that you have these excess pimples that are difficult to treat. So a lot of people don't know until they actually get married and then start trying to get pregnant.
What causes PCOS?
Nobody knows the cause of PCOS. Like there is no culprit we can hold. It's an idiopathic condition. We don't know. But we know that there are factors that contribute. Factors that when they come together, you now put 2 and 2. It go be like saying PCOS. So you now start doing extra tests to confirm
that it is.
So we don't really have a specific thing we can accuse.
Now when you have excess that means the insulin is now in the blood. Now when you have excess insulin in the bloodstream, there's now an increase in androgens. And again, for our viewers, please let's remember that androgens are the male hormones like testosterone. Like Dr. Nne said, they are found naturally in male and female. But what makes us women, what makes us female is that ours is higher than the male hormone, and for men theirs is higher than the female hormone. But when this insulin is in the bloodstream, over time it can cause an increase in androgen, and that can now cause an imbalance in the hormones. And there's something that you said something that if ovulation does not happen, pregnancy cannot happen. Thank you. I caught that, man. How would a healthcare provider diagnose PCOS?
We don't have a PCOS test, like a test that is for PCOS. We don't have it. But when you come into the hospital and start complaining, for like 3 months, 4 months, I've not seen my period, you now make that kind of complaint. We'll now do a physical exam to now know if we have those other signs we mentioned, the harsh acne, darkening of skin tags. Then we start running things like blood tests to confirm that high androgen level. We can also do pelvic scans.
That's kind of like a hormonal profile, right?
Yes. Okay. So we can also do a pelvic scan to see if you have cysts in your ovaries. That is follicles that did not mature and release eggs. They trapped them. They are the ones that form that cysts. But not everybody that has PCOS has cysts. That's why the name polycystic ovarian syndrome. It's a syndrome. You may or may not have cysts, but they are likely to be there. Because once they are there, that means the eggs are being trapped, they are not released, which is ovulation, so no pregnancy. Okay. So it's just a combination of tests.
Okay. Is PCOS the same thing as endometriosis? Because endometriosis is another thing that happens to our gender. Well, are they the same?
No, they are not the same. They are not the same, but they are headed towards the same direction. Infertility.
Okay. All right. So endometriosis and PCOS are not the same thing.
Oh, somebody that has endometriosis actually ovulates more than somebody that has PCOS.
Oh,
yes, the person has chances of the egg being released, because endometriosis is just that the tissues that are naturally found in the womb, which are the endometrial lining, that are taken in readiness for ovulation and baby making, and if you disappoint them, they will shake and flow out as menses, so they are there. But in endometriosis, you are now finding those kind of tissues in other places that are not there. So that is why you have that pain during menses, pain during intercourse, pain during ovulation.
Can you imagine?
So that's what's giving that pain. But at least the person is ovulating. Your menses is a sign that you ovulated. You cannot menstruate if you don't ovulate. So that's why in PCOS, if you don't ovulate, you will not see your menses. So as the person is menstruating, it shows that they actually ovulate. But it's just this tissues that are in the wrong places that give that pain and heavy bleeding and all of that.
Can one prevent or cure PCOS?
There is no cure, but we can just manage. In fact, it's just like malaria in Nigeria. We can't cure malaria, but we treat. We just manage it, yes. So that's how PCOS is. You just be managing it so that pregnancy can happen, So that's why you have things to put hand for you, like medications, lifestyle changes, and just to help you, find your way around it, but it will not go away. Just like you try fibroids. You may decide not to remove them, but if you find your way around it, you can be getting pregnant with it. So that's how PCOS is. You don't have a cure, but we just have management.
So what are some of the lifestyle things that a woman can incorporate if she has been diagnosed with PCOS?
The late night eating. If you know that your gene does not allow you to eat anyhow, because there are people that even when they are stressed, they're adding weight. When they're tired, they're adding weight. They add weight very easily. So if you know that your body is the type that if you perceive food like this, you add. You cut down. Then don't eat late. Don't eat late. And very importantly, this intermittent fasting, it really helps.
Oh, really?
It really helps. Yes, it really helps.
So what timeline are you looking at?
Lifestyle changes, such as losing weight. Because obesity is a huge factor. Once you are obese, it's going to be causing that insulin resistance. So people to expand androgen. So once you lose weight, that means it will cut down on the rate at which that your insulin is being resisted. Your body tissues and fats will start absorbing insulin and allow the effects to take place. So if you try to lose weight, that too can help. It may not be a solid solution, but it will help, because at least your cycle will start trying to arrange itself. Then you can also try not to have a sedimentary lifestyle. Don't just eat and sleep and stay in the house. Yeah, it's true you can afford fuel to live with your vehicle and all of that, but sometimes try to trek small. It's not punishment.
Especially people who work in the office,
Exactly. From car to office to car. So it's just the same thing every day. Sometimes just try to trek. Sometimes try exercise. Yes, it's going to help you, because you just eat, and then you cut down on your carbohydrate intake, refined sugar, cut down. Some people even do maybe the 3 square meals. They'll remove one. Maybe they'll say I'll eat breakfast and dinner. They'll leave lunch, or I'll eat lunch and dinner. Like that. So you just try to mix it.
How does PCOS cause infertility? I think we've touched on it earlier, but can we elucidate?
Once PCOS is there, it messes up your menstrual cycle. So number one is that your ovulation will cease, so no messes. And since there's no ovulation, there's nothing to fertilize. And again is that the cysts happening in your ovaries is another big wahala, because the ovary is the headquarters of the pregnancy. If it doesn't join in the show, nothing will happen. So it's trapping your eggs and not maturing them. So that's why even if after once you now see one messes like that, that means maybe one egg has been released, but it may not be mature. The quality may be poor. So because there are cysts and a lot of things going wrong with the ovary. So that's why even if you see your menses once in 4 months, once in 3 months, it may not really, in fact, had even you tried that time you saw it, it may not happen. You may not end up in pregnancy getting it. So that's how it affects. It affects your ovaries and your hormones. And it's not just your androgens that are just doing what they shouldn't do. Your estrogen and the other female hormones are now subdued. They cannot even perform their function. Yes, the brain can no longer get the signals to release these things and work the way they should. So that's what this
that one of the benefits that Pregnatab conception has is that it actually helps with PCOS. So I want to quickly explain again to our viewers that we have 2 major types right now. We have the Pregnatab conception and we have Pregnatab original. Pregnatab conception is the one you take in preparation for pregnancy. You're preparing your body for pregnancy, just like you would prepare for a visitor coming, an August visitor. It's the same way you prepare your body for pregnancy. So the vitamins, the minerals, the nutrients in Pregnatab, all in one, it actually helps prepare the body for pregnancy. And one of the benefits of some of the key ingredients in Pregnatab is that it actually helps to alleviate symptoms of PCOS. So now we'll be going right into how Pregnatab conception actually helps with PCOS. So one of the things that Pregnatab conception contains is inositol. So how does inositol help with PCOS?
Inositol actually helps to regulate your menstrual cycle, because that's your number one problem with PCOS. The cycle is upside down. So inositol can actually help to arrange it the way it should be happening, Even N-acetylcysteine also helps to regulate your cycle, so that ovulation will happen when it should happen, and menses will happen when it should happen. Not you now thinking, when am I seeing it? Are you sure I'll be seeing it this month? So that you can track your cycle. And if you're trying for a baby, you will know when to have intercourse. Because if you can't track it, you will not know when to meet.
Okay.
So that is what inositol does, because mind you, I said that PCOS does not have a cure. So Pregnatab will not be a magician to cure it. It will only help to manage the symptoms and try to put things in place for you so that you can get pregnant. And it will also increase your chances of actually getting pregnant and maintain the quality of your eggs.
Yes, somebody wrote here, inositol doing the Lord's work.
Yes, it's doing the Lord's work.
So if inositol actually has it improves insulin sensitivity, that means there won't be excess insulin in the bloodstream that has not done the work it's supposed to do, and there won't be any issue of excess androgen in the system. So can we now see how it's connecting together? So you said something about N-acetylcysteine and fertility.
Yes, it literally does the same thing that inositol is doing. It also maintains the quality of your eggs, so that as lifestyle changes and any other medication that your doctor might want to add for you, as you're trying to balance that your hormones and your cycle, so that that one chance you will have will actually click.
Yes, so
you understand? So it maintains the quality of your eggs and protects them from all this oxidative damage and age. Because you might be trying and trying, but be firewood though, age gonna go down. So it's going to actually help.
How does coenzyme Q10 help with fertility?
Coenzyme Q10 can actually help in balancing your hormones, and so that they don't subdue your feminine hormones so much that you are now having those symptoms like a man. You are not having excess hair growth and all of that. And it's also going to increase the chances of fertilization and implantation happening, because it's not just fertilization. Fertilization may happen, and because of the factors surrounding it, everything will still flush out. So it has to implant and embed into the walls of the womb so that the pregnancy can develop. So, and Pregnatab too, thank God it has the Pregnatab original that will also be adding its value throughout that pregnancy, so that you don't lose it. Because as long as you have a disease condition attached already, you are already a high risk mother. So your pregnancy, they use microscope, they look and nothing happen. You understand? So you have serious attention on you. So because of that, Pregnatab will help to reduce all those stories that touches the ovaries.
For those of us who are not aware, after successfully conceiving, when you're on Pregnatab conception, it is preparing your body for pregnancy. Once you're pregnant, you can switch over to Pregnatab original. And I think it's very important to state this, because some end users ask this question a lot. So what if I go buy Pregnatab conception today, and then I find out tomorrow I'm pregnant? Please, you can actually finish your Pregnatab conception. Yes, it contains all the nutrients your baby will benefit from before you now switch over to Pregnatab original, which you can use all through pregnancy. Coenzyme Q10, I link it to anything about energy. Energy helps with energy production, and the work of reproduction is not an easy thing. The body needs a lot of energy to get this done. So coenzyme Q10 actually helps. And then Nurse Ndi Nne, you also mentioned something about age-related fertility. So some people, sadly, some women, the older they get, the lesser their egg quality is. So this coenzyme Q10 can actually help improve the egg quality. So it's not depreciating, it's not
irrespective of your age.
Yes, irrespective of your age. So the beautiful thing I love about Pregnatab conception is these three major ingredients. So, we have other things in it too. I'm just singling out these three. They work in synergy, because does PCOS cause early menopause?
It can. Premature menopause. It can contribute. There is possibility of that happening, because your eggs are just piling up there, immature and trapped, So with time, the age can hit, and other factors may just put their own contribution to, and menopause can come. So it's possible, because you're not menstruating and you're not making any baby.
Can PCOS lead to other health problems?
Yes, so number one, diabetes.
Yes.
Diabetes, yes, because you have excess glucose in your bloodstream. Your tissues are not absorbing the glucose to use it as energy, as it should. So that is the insulin resistance we have been saying since. It's equal to diabetes. And once there is diabetes, you must see its younger brother, hypertension. You must see it there.
Thank you so much, Nurse Ndi Nne. It's been so wonderful talking to you here. Thank you for taking your time to break it down. I think you should add professor to your name. So Professor Nurse Ndi Nne, PNNN. Thank you.